On HealthWise today, we're with Bree Veldboom, certified nurse practitioner at Winona Health, and we're going to talk about the patient care team model approach to healthcare today. And Bree, thank you for being with us today.
Thank you for having me.
If you could tell us a little bit about yourself and what brought you to Winona.
Sure. I'm a new nurse practitioner. I'm a recent graduate from Viterbo University in La Crosse in the Family Nurse Practitioner program, so I do have a master's degree from there. My husband and I were hoping to stay somewhat within the area, and I was really looking forward to going directly into family practice. I had that opportunity here at Winona Health.
You work as part of a patient care team here at Winona Health. Could you explain or define what a care team is?
It's a group of individuals, so you'll have a physician or an MD and an associate provider, so a PA or an NP. You have nursing staff and other staff who all work collaboratively to take care of the patient.
You're a nurse practitioner. Can you tell us a little bit about what a nurse practitioner is and what they do?
We're able to assess a patient, order and interpret diagnostic testing or labs, then make a diagnosis. We can also prescribe medications just like the doctors do, and then we can go on and to follow a treatment plan. So that may be patient education or follow-up care as needed.
So as a nurse practitioner, what is your role as part of the patient care team?
I look at us as one of the two providers if your care team has two providers. For me, I'm on a care team with Dr. Begwin and Virginia Green, who is another NP. So we have three providers within our care team. So I'm the go-to person when you're coming in the room. The education, most of your time spent in your exam room will be with either myself or one of the other two providers, but we work with the rest of the staff in the department.
What are some of the advantages that a care team approach has for the patient?
For the patient, it's to maximize their availability to primary care. So, for instance, in the past when you only have one provider, their schedule may be full that day and you're not able to see them, and say you may have to go to urgent care that day. The goal with the care team is allowing you to build continuity with a group of providers, whether that be two or three, that you see on a regular basis. For instance, if one of the patients on our care team group is unable to see Dr. Begwin today, hopefully they'll be able to see myself or Virginia.
Winona Health has been recognized as the most wired hospital. What role does technology play in this approach to patient care?
We use the electronic medical record as a way of securely documenting a patient's record. It's also a great way when we're using the care team model in order to share information with other providers. For instance, Dr. Begwin may see you on this visit, and next visit you'll see me. I'll be able to read all of his notes, have access to all of his records as well, so we're able to share that information securely.
Well, Bree, thank you so much for taking some time out of your schedule today to talk with us a little bit about the patient care team model approach.
Thank you for having me.